This is the Prime Minister. Let's just listen into what he's got about this announcement.
For the one we're in right now. I want every Australian, particularly every young person, to be able to access the mental health care that they need. We will deliver $1 billion to roll out more services and locations Australians can go for free public mental health care. This investment is going to be so important for young people. Only Labor has a plan to strengthen Medicare. And what this will do is make sure that more Australians, particularly more young Australians, can get the help they need with this card here, with their Medicare card. That's the promise of Australia, the promise of a fair go, the promise of not leaving people behind that my government's absolutely committed to. This will be critical because we know that 1 in 5 adult Australians experience a mental health issue for a year or more. And we want to provide more support for more people in more locations, and that's what today's announcement will do. We will deliver 31 new and upgraded Medicare mental health centres on top of the 61 that we're already committed to. 58 new upgraded or expanded headspace services, such as this fantastic facility that serves mine and Sally's electorate here in the inner west of Sydney. 20 youth specialist care centres for young people with complex needs, and more than 1,200 training places for mental health professionals and peer workers. The new youth specialist centres will close a critical gap that has been there in our mental health system. It will mean that young people with complex mental health needs, like personality disorders, eating disorders and early psychosis, will get the care that they need outside of a hospital setting. We'll also deliver an ongoing uplift in mental health funding to make sure that Australians get the services that they need. And this is on top of the previous announcements that we've made, rolling out commitments including the mental health centres, the 12 perinatal mental health centres to provide support to new parents, expanding the Headspace network and restoring bulk bill telehealth psychiatry Medicare rebates so that Australians who are living in regional areas or remote areas outside of metropolitan areas can get equal access. Australians can find out, and I'll conclude with this before I turn to the Health Minister, and then we'll hear from Professor McGorry before we hear from Emma. Australians can find out more about free mental health services by contacting the Medicare mental health phone line on 1800 595 212. That's 1800 595 212, or by visiting medicarementalhealth.gov.au. We'll hear from the Health Minister and then the Professor and then Emma.
Well, thank you, Prime Minister, for having us to your electorate and to Sally. I know you were at the opening of this service 10 years ago. When I was young, these services didn't exist. If you had a mental health issue as a young person, you were expected to visit Mum and Dad's GP, and perhaps unsurprisingly, not many young people did. Over the past 20 years, Australia has led the world in building this youth mental health ecosystem. Headspace is a core part of it, not the only part, but a really important part of it. And it gives a level of support to young Australians that, frankly, most countries around the world just don't have. We know that most mental health disorders emerge when you are in your teens or in your early 20s. So having services like this where young people feel comfortable attending, where they're involved in co-designing the type of service that Ashfield, Headspace and others deliver, is critically important to delivering that support at that important part of a young person's life. Today we extend our Strengthening Medicare program into mental health with a $1 billion investment in the mental health of all Australians, but particularly young Australians. And we're building on investments that we've been putting in place for the last few years that deliver free mental health services. We know that access to good mental health support is a really important challenge, really significant challenge in the community, but so is affordability. Far too many services in the private market cost too much and are simply beyond the means of many, many households. And they're not available in many communities in the outer suburbs and in regional Australia as well. So expanding the number of walk-in Medicare mental health centres will open up access to support to people in our community that have nothing in their local community. Expanding and upgrading Headspace services, almost 60 of them, will give that additional support to young people that we know is demanded out there through the numbers of mental health issues. And I'm really excited about the expansion to something Pat McGorry championed 10 or 15 years ago, the early psychosis services that exist now that we funded when we were last in government will be increased in number to 20, but also expanded to cover conditions other than psychotic disorders. So they'll be expanded to cover complex eating disorder, borderline personality disorders and the like as well. Building on that support for what Pat has called the missing middle, where young people are too unwell to be able to adequately cared for in a service like this, but not yet unwell enough to qualify for support from the state government acute care systems. This is a critical investment for our community, an investment in the future of these young Australians who at the moment are languishing in what Pat McGorry has rightly called the missing middle. The last element is a really important one, as the Prime Minister said. Mental health services need to grow in this community. Demand for support is growing, but we're not growing the workforce fast enough. We've invested in the last couple of budgets in growing the number of psychologists and other mental health workers, and today's announcement includes 1,200 additional training places to continue to grow that psychology workforce, to find new ways in which people can get psychiatry training, and to grow that peer workforce that is just so important for mental health. I'm delighted we've been able to partner again with Professor McGorry. When I was appointed as the first mental health minister ever at a Commonwealth level, Professor McGorry was Australian of the Year back in 2010, and we were able to partner to massively expand this Headspace network, but also introduce this very important service for young Australians with complex needs. And I'm delighted we've been able to come together again and take those services to their next level. And I'll hand over to Patrick.
Well, firstly, I just want to say how grateful I am to the Prime Minister and to the Health Minister and to Assistant Minister Emma McBride for today's breakthrough announcement. This is, without exaggerating, this is visionary, because what we are seeing now is the Commonwealth building a system of care in the community, not just for young people, but for older Australians as well, but particularly young people. We are facing a youth mental health crisis around the world. 2 out of 5 young people need professional help. It's a shocking figure. And the government is acting decisively now to fill that gap. You've heard about the missing middle. It's not just about strengthening the primary care level of Headspace. It's also building a system that helps those young people with more complex problems get access to scientifically based care, which has been a rarity in mental health. But we must fight for that, because we have treatments that work. They have to be made available to young Australians and their families. And they have to be free. This is the other great thing about this announcement. We're not dependent on co-payments. Young people currently pay 2 to 3 times more than older people in out-of-pocket expenses with the current model. So this is a massive breakthrough in building a system of care that will last into the future and turn back the tide of this mental health crisis in young people. So every Australian family should be very happy today, because they're seeing really great reform in place now. The workforce issue, as the Minister just referred to, is very important. It's not an easy job working in youth mental health. It takes skill, it takes compassion, it takes affinity with young people. And we need to build a workforce that's capable of doing that. So just to finally, I'd just like to again express our gratitude on behalf of every Australian family to the government for this announcement today. Thank you.
I want to begin by acknowledging the leadership of the Prime Minister in acknowledging the need for young people and their families right across the country, to Minister Mark Butler for the work that you have done now more than over a decade to improve access to support and care for young people, and to local MPs like Sally Situ, who every day listen to and advocate for improved services and better care for young people and families in their community. I've worked in mental health for since the early 2000s, and As the Assistant Health Minister, I have visited communities right across the country, including, I think, almost 50 headspaces. And what this means for Australians and their families is improved access to care, quality care, affordable care, close to home. And I was reflecting to Minister Butler about my early years working in mental health, where young people in the community in distress would end up at crisis and be brought in by police or ambulance to the mental health inpatient units where I used to work. Now we will see in Australia a system of care that is better matched to meet each person's needs wherever they are, wherever they live, and importantly for free. We're bringing mental health care into Medicare and into the heart of communities. I'll finish there.